Here's something fascinating that most people never learn until it's mentioned to them directly. Your age on a calendar, 60, 65, 70, isn't necessarily the same as your body's biological age. Two people born in the exact same year can be aging at genuinely different rates, one gradually losing strength, resilience, and vitality faster than expected, while the other remains remarkably steady, strong, and capable well into their 80s. The difference often isn't luck. And it isn't simply genetics either, though that plays some role. Very often the difference shows up first in small subtle signs your body has been quietly giving you, signs most people either don't notice or simply dismiss as just getting older. Today, I'm going to walk you through 9 of these warning signs in a specific order, explaining exactly what each one may indicate, the science behind it in plain language, and most importantly, what you can genuinely do if you recognize yourself in any of them. I want to be clear immediately, this video isn't meant to frighten you. Quite the opposite. Recognizing these signs early is one of the most empowering things you can do for your own health, because so many of them respond remarkably well to attention and simple changes once you know what to look for. Stay with me until the very end, because sign number 1, the final one on this list, is something most people have never even heard mentioned by a doctor before, yet research suggests it may be one of the most telling indicators of all. Hello, and thank you for spending this time with me today. I'm Dr. Richard Williamson. I've spent more than 20 years working in emergency medicine, and throughout my career, I've had the privilege of caring for thousands of patients in their 60s, 70s, and beyond. And one thing has become increasingly clear to me over the years: chronological age tells only part of the story. I've cared for people in their 50s who showed remarkable signs of accelerated aging, and I've cared for people in their 90s who remained sharp, strong, and vibrantly independent. The patients who aged well, in my experience, weren't simply lucky. Very often, they were the ones who noticed subtle changes early, brought them to their doctor's attention, and made thoughtful adjustments before those changes became more significant. That's exactly what I want to help you do today. Before we begin, I want to say clearly, everything I share today is general medical information drawn from clinical experience and established research. It's not a diagnosis, and it's not a substitute for a proper evaluation from your own doctor who understands your personal health history far better than I ever could through a video. If any of these signs resonate with your own experience today, please bring them up during your next appointment. That conversation could be genuinely valuable. Let's begin our countdown. Number 9 on our list is a noticeable decline in grip strength, something that might seem like a small, insignificant detail, but which researchers have increasingly recognized as a genuinely meaningful marker of overall aging. Here's the science, simplified. Grip strength reflects far more than just your hands and forearms. It's associated in numerous studies with your overall muscle mass, your neuromuscular function, meaning how effectively your nerves and muscles communicate, and even broader markers of cardiovascular health throughout your body. Researchers sometimes refer to grip strength as a window into overall physical resilience, precisely because it's simple to measure, yet reflects so much happening throughout your entire body. When grip strength declines faster than expected for your age, it may be an early sign of a broader condition sometimes called sarcopenia, the gradual, accelerated loss of muscle mass and strength that can occur with aging, particularly when combined with reduced physical activity. I think of a patient, a man I'll call Edward, 67 years old, who mentioned during a routine visit that he'd recently struggled opening a pickle jar, something that had never given him trouble before. He mentioned it almost as a joke, attributing it simply to getting older, without giving it much further thought. When we discussed this together, and I explained some of the research around grip strength as a broader health marker, Edward became genuinely curious rather than dismissive. We talked about simple ways to assess and address this, using a hand grip strengthener, inexpensive and available at most pharmacies, squeezing gently several times daily, and incorporating activities that naturally challenge grip, like gardening or carrying groceries rather than always relying on a cart. After about 2 months of this consistent, gentle practice, Edward mentioned, with genuine satisfaction, that he'd successfully opened several stubborn jars that week without any struggle, a small victory, but one that felt meaningful to him personally. I want to reassure you, if you've noticed something similar in your own hands, this is genuinely one of the more improvable signs we'll discuss today. Grip strength responds well to simple, consistent practice, and improvement is absolutely achievable with patience. Now, let's move to our 8th sign, something that involves an organ most people never think to associate with aging at all. Number 8 on our list is thinning, fragile, or slow-healing skin, particularly noticeable bruising that seems to happen more easily than it used to, even from minor bumps you'd barely have noticed years ago. Here's the science, simplified. Your skin contains collagen and elastin, proteins that provide structure, elasticity, and support to the small blood vessels running throughout it. As we age, collagen production naturally declines somewhat. This is a normal part of aging for everyone. However, when this decline happens more rapidly than expected, skin can become noticeably thinner, more fragile, and more prone to bruising and slower wound healing, sometimes reflecting broader nutritional deficiencies, medication effects, or accelerated cellular aging happening throughout the body. I recall a patient, a woman named Margaret, 71 years old, who came to see me concerned about bruises appearing on her arms and legs from what she described as barely bumping into things, bruises that also seemed to take considerably longer to fade than she remembered from years past. We discussed her situation carefully and reviewed her medications together, since certain blood thinners and other common medications can contribute to this pattern. We also discussed her diet and discovered her vitamin C intake, which plays an important role in collagen production, had been fairly limited in recent years since she'd naturally reduced her fruit intake somewhat due to some digestive sensitivity she'd developed. Working together with her doctor, we made some thoughtful adjustments, incorporating more vitamin C-rich foods she tolerated well, like cooked spinach and bell peppers, and monitoring her medication levels more closely. Over the following months, Margaret noticed her skin felt somewhat more resilient, and bruising, while not eliminated entirely, became noticeably less frequent and less severe. I want to reassure you, if you've noticed increased bruising or slower healing, please mention this to your doctor, since it can stem from several different causes worth properly investigating: medication effects, nutritional factors, or occasionally other underlying conditions. But please also know, this is often a very manageable sign once the underlying contributing factors are properly identified and addressed. Now, let's move to our 7th sign, something involving a sense most people never consider tracking until they notice it's genuinely changed. Number 7 on our list is a noticeable decline in your sense of smell, something research has increasingly connected to broader patterns of aging, and in some cases, overall brain health. Here's the science, explained simply. Your sense of smell relies on specialized nerve cells located high in your nasal passages, cells that connect directly to regions of your brain involved in memory and processing. Some research suggests that a more pronounced decline in smell, beyond what's typically expected with normal aging, may be associated with broader patterns of neurological aging, and researchers continue studying this connection actively, particularly regarding its relationship to long-term cognitive health. I want to be careful and balanced here. A decline in smell doesn't mean something is definitely wrong, and many people experience this simply as a normal part of getting older, often related to sinus issues, medications, or simply natural aging of these nerve cells over time. But a more sudden or significant decline is worth mentioning to your doctor, simply so it can be properly evaluated. I think of a patient, a man named Harold, 69 years old, whose wife mentioned during one of his visits that he'd stopped noticing when food was burning on the stove, something that had happened a couple of times recently, concerning her enough to bring it up directly. We discussed this together, and Harold admitted he genuinely hadn't noticed the change himself. It had happened so gradually. We performed a simple assessment and discussed his overall health more broadly, including his diet, his cardiovascular health, and any other neurological symptoms he might have noticed. In Harold's case, we didn't find anything seriously concerning. His decline appeared to be related primarily to some ongoing sinus congestion he'd been managing for years, along with typical age-related changes. But addressing his sinus issues more thoroughly with his doctor did lead to some meaningful improvement in his sense of smell over the following months. I want to reassure you, if you've noticed changes in your sense of smell, please mention this to your doctor, simply as part of your overall health conversation. In many cases, there's a straightforward explanation, and even when there isn't, early awareness allows for better monitoring and support moving forward. Now let's move to our sixth sign, something involving a pattern many people experience but rarely connect to their overall health. Number 6 on our list is persistent, unexplained fatigue, tiredness that doesn't improve with adequate rest, and that goes beyond what feels like normal, occasional tiredness after a busy day. Here's the science, simplified. Persistent fatigue can stem from numerous causes, some directly related to accelerated aging processes, and others reflecting separate, treatable conditions entirely. Chronic, low-grade inflammation, which tends to increase somewhat with age, but can become more pronounced due to lifestyle factors, is one contributor some researchers associate with this kind of persistent tiredness. Additionally, declining mitochondrial function, mitochondria being the tiny structures within your cells responsible for producing energy, is another area of active research regarding aging and fatigue. However, I want to be very clear. Persistent fatigue can also indicate several very treatable conditions, including thyroid imbalances, anemia, sleep disorders like sleep apnea, or vitamin deficiencies, all things absolutely worth discussing with your doctor, rather than simply attributing to getting older. I recall a patient, a woman named Dorothy, 68 years old, who came to see me feeling persistently exhausted for several months, despite what she described as adequate sleep each night. She'd assumed this was simply an inevitable part of aging, something to accept rather than address. We ran some basic blood work together and discovered her thyroid function was somewhat underactive, a common and very treatable condition, particularly as we age. With appropriate treatment, guided carefully by her doctor, Dorothy's energy levels improved meaningfully over the following weeks. I want to reassure you, if you've been experiencing persistent, unexplained fatigue, please don't simply accept this as an inevitable part of aging. There are often genuinely treatable underlying causes, worth investigating properly with your doctor's guidance. Now let's move to our fifth sign, something involving a pattern that connects surprisingly directly to your cardiovascular health. Number 5 on our list is a noticeable decline in exercise tolerance. Finding yourself considerably more winded during activities that used to feel comfortable, climbing the same set of stairs, walking the same familiar distance, activities that once felt routine, now leaving you unexpectedly breathless. Here's the science, simplified. Your cardiovascular system, your heart, your lungs, and the blood vessels throughout your body naturally undergoes some changes with age. However, a more significant, noticeable decline in exercise tolerance may reflect accelerated cardiovascular aging, sometimes connected to underlying conditions like reduced heart efficiency, narrowing blood vessels, or reduced lung capacity, conditions that benefit considerably from early attention and appropriate medical evaluation. I think of a patient, a man named Walter, 70 years old, an avid walker who'd noticed over the previous several months that his usual walking route, one he'd comfortably completed for years, had started leaving him unexpectedly breathless partway through, requiring him to pause and rest more frequently than ever before. Walter, wisely, didn't simply dismiss this as normal aging. He brought it to my attention directly. We performed a thorough cardiovascular evaluation, including his blood pressure, cholesterol levels, and a stress test, working closely with a cardiologist to investigate further. We discovered some narrowing in one of his coronary arteries, something that, thankfully, was caught early enough to be managed effectively with medication and closely monitored lifestyle adjustments, rather than requiring more significant intervention. I want to reassure you, if you've noticed your own exercise tolerance declining more than feels typical, please bring this to your doctor's attention promptly, rather than assuming it's simply expected. Early evaluation genuinely matters here, and many underlying causes are quite manageable when caught early. Now let's move to our fourth sign, something involving your mind specifically, an area many people feel understandably anxious discussing, but which deserves honest, calm attention. Number 4 on our list is noticeable changes in memory or word finding, beyond what's typically considered normal, occasional forgetfulness. Here's the important distinction I want to make clearly. Occasionally forgetting where you placed your keys or momentarily struggling to recall a familiar name, these experiences are common at any age and become somewhat more frequent with normal aging. What's worth paying closer attention to is a more noticeable pattern. Difficulty following familiar conversations, getting lost in previously familiar places, or family members specifically mentioning changes they've noticed in your memory or communication. I want to be genuinely reassuring here. Many causes of noticeable memory changes are entirely treatable. Medication side effects, vitamin B12 deficiency, thyroid imbalances, sleep disorders, and even significant stress or depression can all contribute to memory difficulties that improve considerably once properly addressed. I recall a patient, a man named Robert, 72 years old, whose daughter mentioned during a visit that she'd noticed him repeating questions he'd already asked earlier in their conversation, something that concerned her enough to encourage him to schedule an appointment specifically to discuss it. We conducted a thorough evaluation together, including blood work, checking his vitamin B12 levels and thyroid function, a review of his medications, and a discussion about his sleep quality and overall mood. We discovered his vitamin B12 levels were notably low, a common and very treatable deficiency, particularly among older adults. With appropriate supplementation, guided by his doctor, Robert's memory and clarity improved meaningfully over the following months. I want to reassure you, if you or a loved one has noticed changes like this, please have this properly evaluated rather than assuming the worst. Many contributing causes are genuinely treatable, and even when evaluation reveals something requiring longer-term management, early identification allows for the best possible support and planning. Now, let's move to our third sign, something involving a pattern that often develops so gradually, people don't recognize it until someone else points it out. Number 3 on our list is a noticeable slowing in walking pace, sometimes called gait speed by researchers. Something we touched on briefly in a previous conversation, but which deserves its own dedicated attention here specifically as a marker of accelerated aging. Here's the science, simplified. Walking pace reflects a combination of muscle strength, cardiovascular fitness, balance, and neuromuscular coordination working together. Research has consistently found that a more significant decline in walking speed, beyond what's typical for your age, is associated with broader markers of accelerated physical aging, and some researchers have referred to gait speed as almost a vital sign for overall health, similar to blood pressure or heart rate. I think of a patient, a woman named Susan, 69 years old, whose husband mentioned that he'd noticed himself walking ahead of her more frequently during their regular walks together. Something that had developed so gradually over the previous year or two that Susan herself hadn't fully registered the change. We discussed this together and identified some contributing factors, including some mild joint discomfort in her knees that she'd been quietly managing without much attention, and a general decrease in her overall activity level since a minor injury the previous year had temporarily interrupted her routine. We worked together on a gradual walking program, alongside some gentle strength exercises for her legs specifically, and addressed her knee discomfort more directly with her doctor's guidance. After about 3 months of consistent effort, Susan's walking pace improved meaningfully, something both she and her husband noticed clearly during their regular walks together. I want to reassure you, if you've noticed your own walking pace slowing more than feels typical, please know this is genuinely improvable for most people through consistent activity and addressing any underlying contributing factors properly. Now, let's move to our second sign, something involving a pattern connected closely to inflammation throughout your entire body. Number 2 on our list is unexplained joint stiffness or pain that seems disproportionate to your activity level. Discomfort that persists even during periods of rest, rather than simply following unusually strenuous activity. Here's the science simplified. Some joint stiffness with age is entirely normal, reflecting natural changes in cartilage and joint fluid over the years. However, more significant, persistent stiffness, particularly when it doesn't correlate clearly with activity level, may reflect increased systemic inflammation throughout your body, something researchers increasingly associate with accelerated aging processes more broadly, sometimes referred to as inflammaging, a gradual increase in low-grade inflammation that can accompany aging, particularly when combined with certain lifestyle factors. I recall a patient, a man named Gerald, 66 years old, who mentioned experiencing persistent stiffness in his hands and knees, discomfort that seemed present even on days when he'd done very little physical activity, which genuinely puzzled him since he'd always associated joint discomfort specifically with overexertion. We discussed his overall diet, his sleep quality, and his general activity level together. We discovered his diet included quite a lot of processed foods and added sugars, patterns some research associates with increased inflammatory markers throughout the body. Working together, Gerald made some gradual dietary adjustments, incorporating more anti-inflammatory foods like fatty fish, leafy greens, and berries, while reducing processed food intake somewhat. After about 2 months of these consistent changes, alongside gentle, regular movement, Gerald reported his joint stiffness had noticeably improved, something he hadn't necessarily expected from dietary changes specifically, but which made sense once we discussed the underlying inflammatory connection together. I want to reassure you, if you've experienced something similar, please discuss this with your doctor, since joint discomfort can stem from several different causes worth properly investigating. But please also know, dietary and lifestyle adjustments genuinely can make a meaningful difference for many people experiencing this particular pattern. And now, we've arrived at our final sign, the one I promised you at the very beginning, something most people have genuinely never heard a doctor mention before, yet research suggests it may be one of the more telling indicators of overall biological aging. Number 1 on our list is a slower heart rate recovery after physical activity, meaning how quickly your heart rate returns to its normal resting level after exercise or exertion, rather than simply how fast your heart beats during activity itself. Here's the science, explained simply. When you exercise, your heart rate naturally rises. After you stop, a healthy, well-functioning cardiovascular system typically brings your heart rate back down toward its resting level relatively quickly, often within 1 to 2 minutes for many people in good cardiovascular health. Research has found that a slower recovery time, your heart rate remaining elevated for a notably longer period after exertion, is associated with various markers of cardiovascular aging and overall autonomic nervous system function, the part of your nervous system that regulates automatic processes like heart rate, digestion, and blood pressure. Here's a simple way you could get a general sense of this yourself, though please discuss any specific concerns with your doctor, who can properly interpret your individual results within the context of your overall health. After a period of moderate activity, perhaps a brisk walk up a flight of stairs or several minutes of brisk walking, note your heart rate immediately afterward. Many people can check this using a simple pulse count at their wrist or a home heart rate monitor if you have one. Then, check again after about 1 minute of rest, noting how much your heart rate has decreased during that single minute. I want to be careful and balanced here. This isn't meant to be a definitive diagnostic test you perform casually at home. And interpreting these numbers properly really does require your doctor's guidance, particularly regarding what's considered a healthy range for your specific age and health situation. But I share this because it genuinely surprises people and because it opens an important, worthwhile conversation with your own doctor. I think of a patient, a man named Thomas, 68 years old, who mentioned, almost in passing, interesting that he'd noticed his heart seemed to stay racing for quite a while after even moderate exertion, something he'd simply attributed to normal aging without much further thought. We discussed this together, and I encouraged him to bring it up specifically during his next cardiology follow-up, since he was already being monitored for some mild, previously identified blood pressure concerns. His cardiologist performed a more thorough evaluation, including a proper exercise stress test, and discovered his heart rate recovery was indeed slower than would be expected for his age and overall health profile. Working closely with his cardiologist, Thomas made some adjustments, including a more structured, gradually progressive walking and cardiovascular exercise routine, closer monitoring of his blood pressure medication, and some improvements to his sleep quality, since poor sleep can also affect this particular cardiovascular marker. Over the following several months, follow-up testing showed meaningful improvement in his heart rate recovery time, something Thomas found genuinely encouraging and motivating to continue his efforts. I want to reassure you, if this particular marker interests you or concerns you after learning about it today, please bring it up directly with your doctor. They can properly assess your cardiovascular health through appropriate testing and guide you toward meaningful improvement if needed. This is genuinely one of those signs that responds well to consistent cardiovascular exercise, proper sleep, and overall lifestyle attention over time. Let's bring everything together now because we've covered quite a lot today, and I want this to feel clear, balanced, and genuinely encouraging as we close. We talked about declining grip strength, a simple but meaningful marker of overall muscle health. We talked about thinning, fragile skin, and easy bruising, often connected to collagen changes, medications, or nutritional factors. We talked about a declining sense of smell, worth mentioning to your doctor as part of your broader health picture. We talked about persistent, unexplained fatigue, which often has genuinely treatable underlying causes. We talked about declining exercise tolerance, an important signal worth investigating with your doctor promptly. We talked about noticeable memory or word-finding changes, many of which stem from treatable causes worth properly evaluating. We talked about slowing walking pace, a comprehensive marker reflecting strength, balance, and coordination together. We talked about unexplained joint stiffness, sometimes connected to broader inflammatory patterns worth addressing through diet and lifestyle. And finally, we talked about heart rate recovery after exercise, a fascinating, lesser-known marker that research associates with cardiovascular and overall physiological aging. I want to leave you with something important before we close today. If you recognize yourself in some of these 9 signs, I want you to feel motivated, not discouraged. Nearly every single pattern we discussed today responds meaningfully to attention, proper evaluation, and consistent, thoughtful effort, as we saw with Edward, Margaret, Harold, Dorothy, Walter, Robert, Susan, Gerald, and Thomas. Real patients who noticed these signs, brought them forward, and made genuine progress as a result. You don't need to address all 9 of these simultaneously starting tomorrow. That would be overwhelming and honestly unnecessary. Instead, I'd invite you to choose just one, whichever sign resonated most strongly with your own experience today, and simply bring it up during your next doctor's visit. That single conversation could open the door to meaningful improvement, exactly as it did for so many patients I've shared with you throughout this video. I also want to remind you sincerely, everything shared today comes from general medical understanding and clinical experience, meant to inform and empower you, not replace personalized guidance from your own doctor who understands your unique health history far better than I possibly could through a screen. Please bring these topics forward in your own care. They're absolutely worth discussing. If this video gave you something valuable today, even just one sign you're planning to mention to your doctor, it would genuinely mean a great deal to me if you'd give it a like. It helps this information reach more people who deserve clear, honest, empowering health guidance. And if you'd like more videos like this one, honest, practical, and made specifically with adults over 60 in mind, please consider subscribing. I create this content because I sincerely believe you deserve better, clearer health information delivered with genuine warmth and respect.